Hello, I'm Joe Stilwill. I'm a medical oncologist here at Menorah Medical Center, and I'm here again with Dr. Suhel Kotwal, a orthopedic oncologist. In our last visit, we discussed Dr. Kotwal's training and kind of what he does. In this episode, we're going to go into a little more detail about that. Dr. Kotwal, can you tell us a little bit more about sarcoma and the treatment and how we approach it?
Thank you, Dr. Stilwill, for this opportunity. Sarcomas, as we discussed last time, they develop from skeletal muscle, bone, tendons, sometimes blood vessels, and they behave a little differently than traditional carcinomas. They appear as lumps around axial, that is the center of the body, or appendicular, which is the limbs. They can be a painless lump for a while and can get easily neglected in daily life as we tend to ignore these problems on a daily basis, but they can end up being sarcomas, which could be potentially fatal when they spread to the lungs and other vital organs.
Okay. And when we talk about how we treat sarcoma, that really requires an expert surgical opinion as well as potentially other modalities.
It's important to know any of these lumps or bumps are not to be ignored, because if patient feels a painless lump, they would generally go to their primary care doctors or or doctors who are not specialized in this kind of care. But it's important to seek out expert care with us, and we have all the tools to take care of that. We launch a set of investigations where we do advanced imaging, biopsies, and staging to find out what type of cancer we're dealing with and what is the best treatment option. We get together as a tumor board and discuss potential treatment options, which is tailor-made for every single individual, and come together as medical oncologists, radiation oncologists, and surgical oncologists to take care of these problems effectively.
Great. All right. Well, thank you so much for joining us today. We'll be back with another episode soon.
Thank you, Dr. Stilwill.
Thanks.